In the hospitals of Belarus and Ukraine, children are born. Some come into the world healthy, crying with strong lungs, their futures bright. Others do not. They are born with hearts that struggle, with spines that did not close, with eyes too small, with skulls incomplete, and their mothers ask questions that have no easy answers. This is the story of the children of Chernobyl, the generation born into the shadow of Reactor 4, the lives touched by radiation, by poverty, by a disaster whose effects echo through time. Close your eyes, let us remember them tonight. The children, the families, the doctors who tried to help, the truth that became lost in politics and denial. In the years following the Chernobyl disaster, doctors across Belarus, Ukraine, and Western Russia began to notice patterns. More children with thyroid problems, more cases of certain birth defects, more infants born with complications. The numbers were rising. The doctors documented what they saw. They filed reports. They requested help. And they were told to stay quiet. The Soviet government had a policy, a secret decree issued in 1988. Soviet doctors were prohibited from citing radiation as a cause of illness or death. The decree was explicit, clear. If a patient developed cancer, it was attributed to other factors: genetics, lifestyle, stress, anything but Chernobyl. The official death toll from the disaster remained frozen at 31. The firefighters and plant workers who died in the immediate aftermath, that was the number. That was the only number the government would acknowledge. Everything else was denied, explained away, hidden behind classified documents and bureaucratic obstruction. But the children kept being born, and the doctors kept documenting what they saw. In the Gomel region of Belarus, the area that received the highest contamination, pediatric surgeon Gennady Burakovsky worked at a children's hospital. He told visitors that only 15 to 20% of infants at his hospital were born healthy. The rest had complications, weakened immune systems, heart defects, developmental problems. Before Chernobyl, Burakovsky said these numbers were much lower. The hospital had not been overwhelmed with sick infants, but after 1986 everything changed. More children needed surgery. More infants did not survive their first year. The mortality rate climbed. Compared to Western Europe, the infant mortality rate in Belarus was 300% higher in the years following the disaster. 3 times as many babies dying, 3 times as many families grieving. And when the families asked why, when they demanded answers, they were told it was not Chernobyl. It was poverty. It was diet. It was stress from the collapse of the Soviet Union. All of these factors were real. All contributed to the suffering. But to deny any connection to the radiation that had fallen across the land, that had contaminated the soil and water and air, seemed to many like a continuation of the original crime. The children with thyroid cancer were undeniable. This was the one health effect that even the most conservative international agencies acknowledged. Radioactive iodine-131, released in massive quantities during the disaster, had been absorbed by children through contaminated milk. Their small thyroid glands had concentrated the isotope, and years later, the cancers appeared. Before Chernobyl, thyroid cancer in children was extremely rare, fewer than 1 case per million children worldwide each year, but in the contaminated regions of Belarus and Ukraine, the rates exploded. By the mid-1990s, hundreds of cases were being diagnosed, then thousands. The increase was undeniable. The connection to Chernobyl was proven. These children underwent surgery, radiation treatment. Many survived. Many are adults now, living with the lifelong need for medication and monitoring, but they were the lucky ones. The ones whose cancers were caught early, the ones who had access to treatment. But what of the other health effects, the birth defects, the developmental disabilities, the immune disorders? Here the picture becomes murky, contested, politicized. International organizations like the World Health Organization and the International Atomic Energy Agency conducted studies. Their 2005 report concluded that aside from thyroid cancer, there was no clear evidence of increased birth defects directly attributable to radiation from Chernobyl. They found that birth defect rates had risen in both contaminated and non-contaminated areas of Belarus. They suggested other factors were responsible: improved detection, better reporting, the stress and poverty of the post-Soviet transition. But local researchers disagreed vehemently. They had been there. They had examined the children. They had the data. Studies from Belarus showed that in areas with the highest cesium-137 contamination, congenital malformations peaked in 1994 at 6 times the pre-disaster rate. Polydactyly, extra fingers and toes, limb reduction defects, multiple malformations occurring together. In the Ukrainian Polessia region, the area closest to Chernobyl, researchers documented significantly higher rates of neural tube defects. Microcephaly, where the skull and brain are underdeveloped. Anencephaly, where major portions of the brain and skull are missing. Microphthalmia, abnormally small eyes. The rates were 1.8 to 2.6 times higher than European averages. These defects appeared not just in the immediate aftermath of the disaster, but decades later. Studies conducted between 2000 and 2017 continued to find elevated rates. Children born long after the explosion, to parents who were children themselves in 1986. The radiation that contaminated the soil had long half-lives. Strontium-90, plutonium isotopes that would remain dangerous for centuries. The question scientists debated was correlation versus causation. Yes, birth defects had increased, but did the radiation cause them, or were other factors responsible? Ukraine in the years after Chernobyl was not a healthy place for anyone. The Soviet Union collapsed, the economy imploded, people lost their jobs, their pensions became worthless, healthcare deteriorated, nutrition suffered. Alcoholism rates soared, poverty became endemic. All of these factors are known to affect birth outcomes: malnutrition during pregnancy, lack of prenatal care, alcohol exposure in the womb. These cause birth defects, documented, proven. So when researchers looked at the contaminated regions and saw elevated rates of certain malformations, how could they separate the effects of radiation from the effects of poverty and social collapse? The international agencies said it could not be done. The data was too confounded. The dose estimates were too uncertain. Without clear correlation between radiation dose and birth defect rates, they could not conclude causation. But the families living in those regions felt abandoned by these conclusions. They saw their children struggling. They knew their villages were contaminated. They knew they ate food grown in radioactive soil, drank water that carried radioactive isotopes, and they were told there was no proven link, that their children's suffering could not be definitively attributed to Chernobyl. The Chernobyl Children's Project, founded by Irish humanitarian Adi Roch, began bringing children from contaminated areas to other countries for respite care, medical treatment, clean food, clean air, temporary escape from the radiation that permeated their daily lives. Studies of these children showed a pattern. The longer they remained in the contaminated areas, the sicker they became. Higher rates of thyroid disease, gastrointestinal disorders, autoimmune diseases, weakened immune systems. When they spent time away from the contamination, some improved. When they returned, they deteriorated again. 85% of Belarusian children were deemed to carry genetic markers that made them Chernobyl victims. This was the term used: genetic markers that could affect their health at any time, that could be passed to the next generation, a biological legacy of the disaster. Mental asylums and orphanages across Belarus filled with children who had severe disabilities: spina bifida, cerebral palsy, profound intellectual disabilities. Adi Roch visited these institutions and documented what she found. She could not prove that any individual child's condition was caused by radiation, but she noted that many such institutions had not existed before Chernobyl. They were built to house the children born after the disaster. The children in these institutions received minimal care, €1 per day per child in some facilities. They lay in cribs, understimulated, undernourished. Many would not survive to adulthood. Those who did faced lives of profound limitation. And their families, if they had not abandoned them, lived with grief and guilt and unanswered questions. Not all of these children's conditions were caused by radiation. This must be acknowledged. Many disabilities have genetic causes unrelated to environmental exposure. Many are influenced by maternal health, by nutrition, by prenatal care. The Soviet system before Chernobyl had hidden away children with disabilities. They were not publicly acknowledged. So comparing pre-disaster rates to post-disaster rates was complicated by changes in reporting, in detection, in social attitudes. But something had changed after 1986. The doctors knew it. The families knew it. Whether the increase was entirely due to radiation, or partly due to radiation combined with other factors, or due to factors unrelated to radiation, became a question that science struggled to answer definitively. What is certain is that millions of people continued to live in contaminated areas. Children grew up eating food grown in radioactive soil, drinking milk from cows that grazed on contaminated grass, playing in forests where the leaves and soil held isotopes that would remain dangerous for their entire lives and beyond. The Soviet government did eventually take action. They decontaminated some settlements. They provided clean fodder for farm animals. They evacuated the most heavily contaminated areas, but it was too little too late. The damage was done. The isotopes were in the environment. The people had been exposed. And the policy of denial continued. Doctors who spoke too openly about health effects faced consequences. Researchers who published data contradicting official narratives had their funding cut. The message was clear. Do not blame Chernobyl. Do not create panic. Do not damage the reputation of nuclear power. This extended to the children themselves. When Addie Roch began her humanitarian work, bringing children out of contaminated areas for treatment and respite, the Belarusian government was not always cooperative. The work highlighted problems the government preferred to minimize. It suggested that the situation was worse than official statements claimed. The children became symbols. For anti-nuclear activists, they represented the hidden costs of nuclear power, the long-term suffering that official death tolls did not capture. For nuclear advocates, they represented the consequences of a flawed Soviet reactor and incompetent management, not an indictment of nuclear technology itself. And for the governments involved, they were a problem, a reminder of a disaster that had devastated their countries, one they wanted to move past. But the children themselves were not symbols. They were human beings. They were babies born with hearts that needed surgery, toddlers with developmental delays, teenagers with thyroid cancer, young adults facing shortened lifespans and uncertain futures. They were real. Their suffering was real, and they deserved better than to have their existence debated and politicized and denied. Today, the third generation lives in the contaminated zones, the grandchildren of those who were alive in 1986. They are born into a world where radiation is part of the background, where dosimeters are normal, where certain foods are still not safe to eat, where the soil their ancestors farmed for generations can no longer be trusted. Studies continue. Researchers monitor birth defect rates. Cancer registries track disease patterns. The data accumulates. And slowly, carefully, a picture emerges. Not a simple picture, not one that supports any single narrative, but a picture of a region that suffered a catastrophic contamination event and continues to live with the consequences. Thyroid cancer in children. Proven. Undeniable. Thousands of cases directly linked to radioactive iodine from Chernobyl, a generation that will need lifelong medical monitoring. This is acknowledged even by the most conservative estimates. For other health effects, the evidence is more complex. Some studies show elevated rates of certain conditions in contaminated areas. Other studies find no clear correlation with radiation dose. The debate continues, the research continues, and in the meantime, the children grow up. Tonight we remember them, not as statistics, not as evidence in a debate, but as individual human beings, each with a name, each with a family, each deserving of health and happiness and a future. We remember the mothers who gave birth in contaminated regions, who wondered if their children would be healthy, who blamed themselves when they were not. We remember the fathers who worked in contaminated areas to provide for their families, knowing they carried radiation home on their clothes. We remember the doctors who documented what they saw, who fought against official denial, who tried to help despite limited resources and political pressure. We remember the humanitarian workers who brought aid when governments would not. And we remember that Chernobyl's legacy is not just concrete and steel and radioactive debris. It is also the children, the generation marked by the disaster, the lives changed, the futures altered, the questions that remain unanswered. Let us rest now, here in acknowledgement of suffering that cannot be quantified, of connections that cannot be proven beyond doubt, but of human lives that deserve to be remembered and honored regardless of what statistics and studies conclude. Sleep well.